Our next award goes to Dr. Lisa Merritt in the category of medicine. And, in addition to running her own practice, I think Dr. Merritt's real passion is making sure that everyone has access to health care, in particular disadvantaged communities. So she started the Multicultural Health Institute to do just that and has probably touched at least 25,000 people in the community with this institute. Let's hear what she has to say.
It is a great honor to be recognized for this award by La Guia and Biz 941, which embodies my lifelong passion to foster greater understanding and connectedness among people. I love people, and I hope for them to learn the greatest joy is to love one another. By sharing resources and working together toward common goals that affect us all, I find great satisfaction in being able to touch and improve the lives of thousands in the community and beyond. Our healthcare system is in sore need of spiritual invigoration. My work through the Multicultural Health Institute is my effort to manifest the change we all wish to see in the world. We seek to reduce health disparities through health education and development of future health providers and fostering collaboration between existing organizations doing the same things. We've touched the lives of over 25,000 people in the last 6 years. Our areas of focus have included HIV/AIDS education, testing and prevention efforts, STEM career education, which is science, technology, education, and math. And we also throw in an A for the arts because I believe creativity is an essential thing for future leaders. We've also done nutrition and wellness programs and developed a cadre of community health care workers called the Gatekeepers of Community Health, because we believe it's important to assess and build capacity of the communities we serve.
Okay. I'm so good at talking about stuff and teaching things, but they want me to talk about myself. It's like, for the first time I'm tongue-tied, I have to look at notes, sorry. Well, I mean, it's just so wonderful, as the other speakers have said, to see this incredible group of people here today. I mean, you are what we all want to see in the world, everybody being together. And, it's like, it reminds me of the Jamaican saying, out of many, one people, because that's who we are, and we are the children of the future and of tomorrow. And I, too, want to give thanks to God, from whom all blessings flow. And I also want to give thanks to my ancestors, Europe, in my dreams, and give me their wisdom and, their strength and their perseverance that comes through me and helps me to try to work to help other people. I just have to thank my family, my wonderful daughter, who's my personal photographer today. And they were the impetus for me moving down here to Florida, and I'm so grateful to them and to their ongoing support. My office manager, Rose, and dear friend, who also has donated a lot of time and space to the Multicultural Health Institute, and so many of our friends and family that are here today and that have supported and encouraged me through this transition here. I couldn't do what I'm doing without the help and support of so many organizations that we work with, and we have a table there of many of our coordinators and collaborators. Could you guys wave your hands there? Yeah, some of them couldn't make it today. They're out in the field working. So I just, they're amazing because the success of what we do together really shows that an ounce of prevention is worth a pound of cure, and that I can do so much more through them and helping them than I can do seeing a patient at a time in my office. We can affect so many more people. And with the help of them, we have helped to be this change we want to see. And investing in them and investing in organizations like True Vine and Greater Hearst and Bethel and Bethlehem and all the other faith communities, working with Genesis Services, working with the Cancer Support Community Suncoast, working with the HIV/AIDS Network. We all share a common goal and vision, and we can work together and build capacity and help improve people's ability to educate and prevent disease, and then build capacity in the community. The Institute of Medicine, in its seminal report, Separate and Unequal, how many of you have ever heard of that report? Yes, not so many, right? This was from the government. It was an objective report that documented, without doubt, that there are separate levels of care given to people, given to African Americans based on nothing other than race. When you qualify for socioeconomic status, insurance status, and all of that, the type of care that is given is inferior. So part of our goal is, if we're going to deal with the health disparities that occur and the increased rates of heart disease and cancer and diabetes and obesity in African American and Latino populations, we have to work to educate the people so that they can take control of their health destiny and that we can begin to change those outcomes and close this gap. I mean, for example, we have an astounding disparity right here in Sarasota in terms of the rate of HIV and AIDS. Many people don't know that Sarasota and Manatee are two of the top 20 counties in the state of Florida in HIV and AIDS. And many people don't know that HIV and AIDS are still the #1 cause of death for young people 15 to 34 in this country. And so we have to do our part to educate people and to begin to change that. Last year we focused on the distribution of our resource guide. And with this information about so many wonderful services, you know, there's so many great people here doing good things, but people don't know about it. People on the ground trying to figure out how to eat, how to get to the next, you know, to 2 different jobs on the bus and these kind of things. We're trying to get that out there with our work in the community. And right now we're working with Jimena, who's over there in the corner. Yay, Jimena. And we have a bilingual version that we're trying to enlarge and to get that printed and distributed so all of our activities in the community, we're able to disseminate this, and in all of our health fairs and things, we're finding people with high blood pressure, diabetes, things totally out of control. And then we're able to show them where they can go and where they can get help. And we can prevent people from having strokes and having heart attacks and getting feet chopped off and having advanced cancers. And in that way, that saves money. It also helps take the burden off of the emergency room. I mean, and I just have to take a moment and say Sarasota Memorial is a fantastic hospital. I've worked in public hospitals all over this country, and I've got to tell you, we are really fortunate here. We have a treasure, but they need our help. And they need the help of programs like this to take the burden off of the emergency room and the other services there for uncompensated care. Because the money's got to come from somewhere, so it's cheaper to prevent it, right? So I just want to say that I really love what I do. I mean, I love getting an award. It's very nice, but I mean, I love doing this. So, and I couldn't do it without all of these wonderful people. And that the power of one person working together is, you know, with others is the power of many. And that perhaps Chief Seattle of the Suquamish Nation said it best. He said, "The earth does not belong to man. Man belongs to the earth. All things are connected like the blood that unites us all. Man did not weave the web of life. He is merely a strand in it. And whatever he does to the web, he does to himself. En como se dijo la señora Luz, juntos podemos realizar este cambio que queremos." ¿Sí? So the power of many joined together in unity towards a common goal of helping one another is unstoppable. So I just want to thank you all for this honor and wish you all the best.